Hi, my name is Andy Feltz. I'm an optometrist from Columbus, Ohio, 1995 graduate of Ohio State University Optometry School.
Well, my name is Dr. Skylar Joseph, and I have been working with 360 Care for a little over a year now.
I'm Dr. Todd Cochran. I came to dentistry a little later than most do. I was in the Army for many years.
My name is Miranda Ross, and I've been an audiologist since 2007.
Hi, I'm Scott Jima, and I'm the Director of Podiatry for 360 Care. I've been with 360 Care for 10 years.
My name is Dr. Bill Metzger. I've been an optometrist for 28 years here in Kentucky.
My name is Amy Peed. I've been in the field of audiology for about 15 years.
My name is Dr. Gary Barth. I'm a dentist practitioner. I've been with 360 Care about 3 years. I'm from Indianapolis, Indiana.
Bradley R. Hammersley. I'm a podiatrist. I've been practicing in Indiana for the past 15 years.
I love working at 360 Care because I feel like I really make a difference in people's lives, and the patients that we treat are very appreciative of what we deliver. Sometimes in the real world, patients don't necessarily appreciate us as much, but our residents really like the fact that we've taken the time to show up, care for them in their facilities, and deliver high quality comprehensive care for them.
I like the idea that we are going into these facilities and helping these residents have access to care that they wouldn't otherwise have access to. And it's a quality of care. 360 has really high standards. They provide quality equipment, and so I feel like I'm not compromising in any way when I'm providing this care.
I love the flexibility that I have in the schedule. Working at 360 Care, it really affords a very family-friendly environment for me, and that was my choice of podiatry as a profession was based upon that in general, and so that carries on with 360 Care. I also like being able to make a difference in what I consider one of the most at-risk populations that we have in this country, and that's our elderly population.
360 Care really offers great clinical autonomy, and an example of that is that you are allowed to treat the patient the way that you see best. We do have to work within the confines of the facility, so we really want to work with the social worker if we have referrals for surgery or other issues that we think the patient could benefit from outside care. As far as the clinical decision making goes, 360 Care doesn't tell you how many glasses you need to prescribe every day. There's no quotas. It's really provide the best care for that patient, and we know that that is going to make our services most valuable.
What I like about 360 Care is I like to be autonomous. I get to decide the care that I want to give to patients and how to deliver it. I enjoy working with older people. I also enjoy the traveling part of the job, and I really like to be able to help people that are basically underserved.
As the clinical director, my role is to really make sure that I guide you in a general sense as far as what are the rules and regulations that we have to follow from the federal government. But within that, I never tell a provider how to practice, how to treat a particular patient. That's completely up to you as the individual provider. You're there doing the evaluations, and you have complete autonomy to be able to do that.
Working at 360 Care is different than working at private practice or maybe a commercial practice because you're using the full scope of your license on a regular basis, a lot of ocular disease. You're getting to just do the doctor piece, right? So you don't have to deal with employees, you don't have to administer, you don't have to worry about billing. You actually get to play doctor all day, and that's what's really fun.
In the day and age of big box stores for audiology, there's often situations where you're working and you feel pressure to sell some number of hearing aids. 360 Care, we're not pressured to fill that quota.
The other thing is that I don't have the office politics, if you will, when you have 5 or 6 assistants and hygienists to deal with, and all their personalities and all that kind of thing. You're just dealing with one assistant who's kind of your loyal right arm, and I really enjoy that as well.
What advice I would give to someone looking to work with 360 Care is that you need to care about patients, you need to care about what you do and provide high quality care.
When I have tough days with patient care, I remind myself that I'm not in this just for the paycheck. I'm in it to provide excellent care to my patients. And, I'm reminded of that fact regarding a patient whose name was Joan, and her toenails were so thick that she couldn't really walk without pain, and she was walking with a walker, and she was so happy to see, when I was finished with her treatment, that she just got up and gave me a hug. And I think that's fantastic.
Engage yourself in the patients. These patients love that you're coming to visit them, and even though it doesn't take much, it takes just a smile, a handshake, just a little small talk about their children. They think you spent an hour with them when you only spend 5 minutes with them. So, and it also makes your day. It really, I get a lot more out of it than the patients do. So, engage yourself with the patients, and I think it'll make all the difference in the world.
So I fitted him with a power behind the ear hearing aid, and the way his face lit up, still to this day, I can't get over. I have been fitting hearing aids for over 30 years. I've never seen a patient react the way he did. It was really so rewarding, and the entire day that I was there, every single nurse and every single aide in the place kept coming up to me every time they saw me walking around. We can't believe Wayne. We can't believe Wayne. He's hearing, he's smiling, he's happy. That really made it all worthwhile.
One of my favorite patients that I saw was a lady named Helen in Murray, and she had lost her dentures when she gone to the hospital and was desperate to get a new set of dentures. And the day I delivered her dentures, she was so happy, so proud, that she went to the busiest hallway intersection in the home and sat there grinning like the Cheshire Cat at everyone that came along, making sure that everyone saw her dentures and how proud she was of those dentures. It was just absolutely wonderful.
So I had a very, very difficult case several years ago, and +7 prescription, worked really hard to make his glasses. A month later they were lost, and the social worker was despondent. So I actually went to the lab and got another pair made and hand delivered them, and the patient was super withdrawn in those 2 weeks and wasn't eating. As soon as we got them their new prescription, their mood changed, their eating habits changed. It really does impact people's lives when you can help them see better. And these people are extremely fragile. And so, we just want to really be able to deliver the care that needs to be delivered, and I'll do whatever it takes to do that.